Go ahead, ma'am.
Good evening, everyone. I'm Dr. Priyanka, fertility specialist at Oasis Fertility Banshankari, Bangalore. So today we will be talking about endometriosis. So what is endometriosis? First of all, endometriosis is a very common fertility issue among many young women nowadays. So see, what is endometriosis is that the inner lining of the uterus, it is called as the endometrium. Now, sometimes, due to any reasons, if these endometrial cells are deposited anywhere outside the uterus, like on the tubes, on the ovaries, or behind the uterus, or any other organ in the body, then it is called as endometriosis. So, now let's talk about how and why infertility may happen in endometriosis. So see, now during every menstrual cycle, now some hormones are released from the brain which act on the endometrium and produce some changes to receive the pregnancy. But if suppose pregnancy does not happen, then this endometrium it sheds off and comes out as periods. So this all the changes which happen in the endometrium of the uterus also happen in the endometriotic implants which are deposited outside the uterus. So every time you bleed during the periods, there is bleeding happening in these endometriotic implants outside the uterus also. As a result, what happens is that inflammatory changes will occur in the pelvis. Because of this inflammation, adhesions start developing between the different organs. So the different organs will start sticking to each other. The tubes and the ovaries may get stuck to each other. The ovaries may be stuck to the side walls of the pelvis, or it may go and stick behind the uterus. So the natural, which is anatomy between the natural relationship between the tubes and the ovaries, that is disturbed. This is one of the reasons why infertility may happen in endometriosis. Also, sometimes because of these adhesions, the tubes can get blocked. If the tubes are blocked, then the fertilization may not happen, and then how pregnancy will happen. Another reason is that because of these inflammatory changes in the pelvis, sometimes the uterine receptivity may also be reduced. That is, the capacity of the uterus to accept the embryo, to implant the embryo, will also get down. It will be decreased. Then another reason is that sometimes a chocolate cyst may form in the ovaries. So what a chocolate cyst is that if these extrauterine endometriotic implants are deposited in the ovaries, every time you bleed during the periods, there will be bleeding happening there, and so more and more blood gets collected in that, and then slowly it develops and forms a chocolate cyst. It is called as chocolate cyst because it contains brown colored blood, which is that is altered blood, and hence the name chocolate cyst. If chocolate cysts are there, it may affect the quality of the eggs. And if the egg quality is poor, the embryo quality may also get down, that will also be poor. And as a result, if it's a poor quality embryo, implantation may not happen. Then again, in endometriosis, even the growth of the eggs and the ovulation that is also affected. See, endometriosis is a progressive disease. It keeps on increasing, it keeps on progressing. It's not like if you undergo a surgery and you remove off all the endometriotic implants and remove off all the chocolate cysts or the adhesions, then it will never happen again. There's no permanent cure for that because it keeps on coming again and again. So the best way to control it is to conceive as early as possible. Because once you conceive, the periods will not be happening, and if the periods are not happening, then the bleeding will not be happening in these implants, inflammation will decrease, and then later on, if you're breastfeeding, again, periods will not happen, so it will be in check, it will be in control. Then coming to the symptoms of endometriosis. So the first and the most common symptom is pain during the periods. So most of the patients they do complain about severe pain during the periods, which start about 3 to 6 days even before periods start, and it continues throughout the periods. Another common symptom is heavy bleeding during the periods. Then again, one more common symptom is pain during intercourse, and that happens more so if these extrauterine implants are deposited in the behind the uterus. Then sometimes there may be pain during passing of urine or passing of stools if these endometriotic implants are deposited on the bowel or the bladder. And again, infertility, definitely infertility is very common in endometriosis, and about 30 to 50% of the patients with endometriosis, they do face infertility, that is difficulty in getting pregnancy. So now coming to the management, how to treat it, how to manage endometriosis. So see, management of endometriosis, it depends upon several factors. That is first and foremost your age, your egg reserve, the symptoms, then the stage of the disease, that is what is the disease severity, then the condition of the tubes, whether the tubes are healthy or not. So if you are young, if the egg reserve is good, if the tubes are healthy, if the male partner, that is your husband's sperm, is also good, and there is just minimal or mild endometriosis, in such cases you can even try naturally for about 3 to 6 months. Or in some cases, we do advise IUI. IUI is intrauterine insemination. That is, in that the husband's sperm is washed and processed in the lab, and then it is directly deposited inside the uterus. So this way, the pregnancy chances are slightly better as compared to trying naturally. Also, in minimal or mild endometriosis, if laparoscopy is done and all the endometriotic implants are removed and the adhesions are cleared up and the normal anatomy between the tube and the ovaries is restored, in such cases, the chances of getting a natural pregnancy increases. Then, on the other hand, if you have severe endometriosis, or if there are big chocolate cysts in the ovary, if the age is more, if the egg reserve is going down, if the tubes and the ovaries are sticking to each other, that is, or the tubes are blocked, that relationship, the anatomical relationship is completely disturbed, or if the husband's sperm is not good, in such cases, IVF is advised, that is a test tube baby. In these cases, the IVF gives the best pregnancy success. Then again, if you have any big chocolate cyst, or if your fertility specialist on scans, she feels that the chocolate cysts can come in the way of getting retrieving out the eggs during IVF. In such cases, you have to undergo a laparoscopy for removal of these chocolate cysts before undergoing IVF. But if the chocolate cysts are not coming in the way of retrieval of the eggs, then in those cases, better not to go for a chocolate cyst surgery, because once the surgery is done, once the chocolate cyst is removed, a lot of eggs are also stripped off. So this decision of removing or not removing a chocolate cyst is to be taken very meticulously and to be decided by your fertility specialist. So, if you have endometriosis, consult a fertility specialist, get yourself properly evaluated, and get a proper management plan prepared, because in this cases, the treatment plan is very important, the timing is very important. Getting the right kind of treatment at the right time is extremely important in endometriosis, as time is of great concern in endometriosis, because as this disease progresses, the chances of getting pregnancy also reduces. So in endometriosis, the main thing is that getting timely treatment, best kind of treatment, selecting the best kind of management, and at the right time, and get conceiving as early as possible. That is a key to success in endometriosis. So, thank you for your patient hearing. If you have any doubts, you can write in the comment section below. What is the most common treatment for endometriosis? So, the treatment for endometriosis, as I told, it depends upon so many factors. It depends upon your age, your egg reserve. It depends upon the stage of the disease, whether it is mild endometriosis or severe endometriosis. So, if, as I told, that if you are young, egg reserve is good, the tubes are healthy, then naturally trying for a couple of months or IUI can be tried. But if there is severe endometriosis, or if your egg reserve is going down, if the tubes are not healthy, they are blocked, the male partner is having sperm problems, in those cases, it is best to undergo an IVF to get conception as early as possible. If your concern is only for pain and not fertility, in those cases, surgeries may also help, or some medical treatment is also available to relieve the pain. Can endometriosis affect egg quality? Yes, definitely. Endometriosis affects all the pelvic organs. It affects the ovaries, it affects the uterus, it will affect each and every part, the tubes also. So egg quality is definitely affected in endometriosis. It comes down. Even the egg growth is affected. The ovulation is also affected. So yes, it does affect all the pelvic organs and the egg quality. Can diet and exercise help endometriosis? Actually, see, a healthy diet, a healthy lifestyle, it definitely helps in everything, in all your fertility issues also. But just as per se, only doing a diet and exercise, it will not help endometriosis. Because endometriosis causes, the way it occurs is different. So definitely, just adopting a healthy lifestyle and by diet and exercise will help in your overall fertility problem. But just as per se, whether it can control the endometriosis, that is not so. Thank you for your patient hearing. If you have any doubts, if you have any fertility issues, feel free to call us or you can visit us at Oasis Fertility Mention.